Hello, everyone. Thanks for joining us. My name is Tim Gray. I'm the Executive Director of Environmental Defense, and I'm pleased to welcome you to the fourth episode of our recovery series today. And we're going to be digging into the links between pollution, health, and COVID-19. In this series, we dive in and answer your most pressing questions on current environmental issues and look at what solutions can pivot Canada towards a greener, healthier, and more resilient economy that puts planet and people first. If you don't know us, Environmental Defense is a leading Canadian advocacy organization that works with government, industry, and individuals to defend clean water, a safe climate, and healthy communities. I'm north of the city today, so I just want to acknowledge where I am. I'd like to acknowledge that I'm here on the traditional, ancestral, and unsurrendered territory of the Anishinaabe, Huron-Wendat, and Algonquin peoples, who are the rightful title holders and stewards of the land, and that Bancroft, which is the town closest to me, is covered by the Williams Treaty. Today, we are all calling in from different locations, and I encourage all of us who are non-Indigenous to recognize and learn about whose land they're on today. As we start this webinar, let's keep in mind that it is Indigenous peoples who are disproportionately impacted by pollution, climate change, and environmental injustice. So today, to dig into the topic at hand, we have two guests. The first is Dr. Bruce Lanphear, who's a health science professor at Simon Fraser University, and he's also a member of Environmental Defense's Expert Advisory Committee. We also have Muhannad, who's the Toxics Program Manager at Environmental Defense. Welcome, Bruce and Muhannad.
Good morning.
Hi, Tim.
Hey, thanks for joining us, both of you. Before we get started, I wanted to explain a bit about how we'll be using the webinar software today. So if you look to the bottom of your screen, you can see a button called Q&A. Just hit that button and type in your questions, and our team will be able to relay them to me. We get a large volume of questions usually, so we won't get to them all, but we'll try to get to as many as possible. We'll also be recording the webinar and posting it on YouTube. So if you have to leave early, or you have someone you'd like to show to it afterwards, like a friend, colleague, etc., we'll be able to send you the link around afterwards and you can share that. Let's just dive into a little overview and introduction to today's topic. Environmental crises almost always have an impact on our health, but one crisis that is inextricably linked to public health is toxic pollution. As I'm sure you've seen in the news, there's been a decrease in industrial emissions and vehicle pollution, as many industries have had to close and people aren't commuting back and forth to work or to school, etc., as much as they were before the pandemic started. But this visible lowering of pollution also makes us wonder, what's the contribution of all these toxic chemicals to our health during regular times? What is toxic pollution? I'm not just talking about smog or air pollution from cars and industrial emissions, although those are important. We've also seen a rise in chemical pollution from the products we use every day. From the furniture in our homes, the personal care products we lather on our skin, to the cleaning products we use to disinfect surfaces in our homes. Over the last few decades, we've seen tremendous progress in reducing toxic pollution in our air, water, and communities, thanks to the efforts of environmental and health advocates, people like you, and governments responding to them. A great example is Ontario's shutdown of the last coal-fired electricity generating plant in 2014. Since then, we have not had a single smog day. For those of you who live in Southern Ontario, you may have missed that. Oh, the air is clean. Well, there's a reason for that. No more electricity being produced by coal. We've also banned highly toxic chemicals like DDT, which is a harmful pesticide, and PCBs. As a result, wildlife like bald eagles have recovered around the Great Lakes, so we know that progress is possible. But the problem is far from over, and in many ways it's getting worse. A recent study found that we now have more than 300,000 chemicals on the market around the world. And in Canada, we have barely scratched the surface in understanding their impacts. The government has only looked at 0.1% of these chemicals in the last number of years. We banned the manufacturing of cancer-causing old-style Teflon chemicals. You may remember those, and they were known as PFAS. But allowed companies to make substitutes that are around 5,000 of them that are quite similar without any safety data. These chemicals are now found in everything from food packaging to baby bibs. Our cleaning products, cosmetics, TV, and furniture are filled with all sorts of toxic chemicals that poison our bodies, our children, and wildlife like orcas and polar bears. And governments have failed miserably to protect the most vulnerable and marginalized people, including Indigenous communities facing continued industrial pollution, and workers who are today being recognized as essential to the survival of society during the COVID-19 crisis. Over the last 2 decades, we have come to understand the real impacts of toxic chemicals on our health and on our society. And today we're discovering that pollution may be one of the primary reasons why many people are dying or experience extreme illness from COVID-19. For example, Health Canada estimates that every year air pollution kills 14,600 Canadians. There is also a compelling body of evidence showing that phthalates, which are hormone disruptors used in fragrances and as plasticizers in food packaging and in all sorts of plastics, are contributing to alarming decline in male fertility across Western countries. I'm going to let Muhannad and Bruce delve into this more deeply to discuss why stronger toxics and pollution laws are urgently needed to better prepare us for respiratory pandemics exactly like COVID-19. So let's get started. First, I'd like to introduce to you Dr. Bruce Lanphear. Bruce is health science professor at Simon Fraser University, where he conducts research to quantify and prevent disease from toxic chemicals and pollutants. He also sits on Environmental Defense's Expert Advisory Committee. Today, he'll be discussing epidemics fast and slow, and how we can be doing a better job at reacting to slow epidemics, like toxic pollution, compared to fast epidemics, like the one we're experiencing with COVID-19. Bruce, over to you.
Thank you, Tim. So as Tim pointed out, I'll be thinking about how these epidemics, the fast ones like the coronavirus epidemic we're in the midst of, and the slow ones like cancer and heart disease that we deal with all the time, differ, and how we react to them differently. And so the title of my talk is Epidemics Fast and Slow, to build on Daniel Kahneman's book, Thinking Fast and Slow. We've all been watching daily, if not more frequently, as the number of deaths pile up from COVID. And this is a graph that many of you may have noticed, where the COVID deaths are inching up to ultimately one day have displaced heart disease as the leading cause of death on that day. Now, that doesn't mean that it's going to displace heart disease death as the leading cause of disease in any particular country at any given year, but it's scary. As we watch these deaths build up, we react strongly to the point where we've even closed down our societies. And yet at the same time, there are 10 to 20 times more deaths from chronic diseases like heart disease, like various cancers, like lung disease, that we accept as normal or inevitable. We do know that many of these chronic diseases are preventable, and yet most of our effort seems to be focused on treatment. And I want to give you a couple of examples focusing mostly on heart disease, just as a way of summarizing this whole research field of chronic diseases. So most of you won't know, and most people pretty much ignore the fact that we know how to prevent hypertension. In fact, during the 1980s in the United States, there was this dramatic decline in hypertension that was largely unexplained. It remained a mystery until very recently. What happened was lead was taken out of gasoline. So we know that we can prevent hypertension. It is not inevitable. There are many societies around the world where growing old does not mean developing hypertension. And yet virtually all of our effort is focused on treatment. We know that hypertension is one of the risk factors that make patients develop more severe cases of COVID. A few years ago, the Lancet Commission on Pollution and Health put out this monograph, this report that showed that 16% of all deaths worldwide, or 9 million premature deaths, happen every year from pollution. Now that's pollution broadly defined, includes everything from secondhand smoke to air pollution to toxic chemicals. And yet we know, and we knew at the time, that this was a dramatic underestimate. Recently, we and others have been publishing work showing that metals like lead and cadmium and arsenic are some of the most important risk factors for coronary heart disease or atherosclerosis. And yet, once again, we focus most of our research and we spend most of our health dollars on treatment, not prevention. And what you can see here is that even at the very lowest levels, we see a steep rise in the risk of dying from coronary heart disease from the very lowest levels. We see that increase. We estimated that there were 185,000 premature deaths in the United States every year from coronary heart disease. In the United States, that estimate hasn't been done yet for Canada. That would make lead the leading cause of death from coronary heart disease. And coronary heart disease is the leading cause of death worldwide. And yet, when we talk about risk factors for coronary heart disease, we focus on those individual behaviors. Did this person smoke? What's their salt intake? Are they physically active? What's their genetic vulnerability? We have largely, as a society, ignored these environmental pollutants that we know are risk factors, like toxic metals, like airborne pollutants. We've let industries off the hook. Our governments have failed to protect us from these environmental hazards that we can individually control. A reliable way to make people believe in falsehoods, Daniel Kahneman said, is frequent repetition, because familiarity is not easily distinguished from the truth. So we've been continually telling people that they're responsible for dying from heart disease. They're responsible for their behaviors, but we failed to regulate the industries that promote those behaviors or expose us to these toxic chemicals. Canada has been at the forefront of looking at the relationship of extraordinarily low levels of airborne pollutant, usually measured as particulate matter less than 2.5 microns. And they're seeing the same pattern we saw with heart disease. That is, beginning at the very lowest levels, you see this steep increase in dying from heart disease. This is all kinds of mortality, including heart disease. What that means is, even as we've been ratcheting down levels of air pollution, which are guidance levels, by the way, these are not enforceable standards, we have failed to protect people from the lowest levels where we see the steepest increase. We can do so much better, and we need to do so much better around air pollutants. And just to give you some idea that exposures to pollutants in the air can be so powerful, following the ban on smoking in public places in Scotland, which is basically airborne particles and lead, right? That's what smoke from cigarettes is. They saw a 20% reduction in acute heart attacks, or AMIs. That's phenomenally large. And yet most physicians that I talk with have no idea about it. As Tim alluded to, new research shows that air pollution, chronic levels of air pollution in cities contributes to the death rate from the coronavirus. For every 1 microgram per cubic meter increase in air pollutants, you see about a 15% increase in death rates. So these are at levels that are relevant to all of the large cities in Canada and many of the smaller ones. We can't live in a state of perpetual doubt, Daniel Kahneman said, so we make up the best story possible, and we live as if the story were true. For the past 50 years, we've lived out of this idea that if we identify new drugs or stem cells or genetics, that we're going to solve our health problems. And yet it's clear over the past 50 years that we've learned a lot about how environmental pollutants and toxic chemicals contribute to these diseases, these chronic diseases, and that they're preventable. And yet we continue to operate out of this obsolete story. Ironically, by failing to protect people from these toxic chemicals and pollutants, we've made them more vulnerable to this newest epidemic of coronavirus. Thank you.
Thanks so much, Bruce. That was great. For those of you who are just joining us, we've just heard from Dr. Bruce Lanphear, professor at Simon Fraser University. Bruce just gave an overview of epidemics, fast and slow. And now I'd like to introduce you to Muhannad. Muhannad Miles is Environmental Defense's Toxic Program Manager. He holds a Master's in Public Health from University of Toronto. Since joining Environmental Defense, Muhannad has been leading the reform of Canada's Environmental Protection Act, or SEPA, which he's going to be touching on today. Muhannad's going to walk us through what Canada needs to be doing in terms of implementing stronger pollution prevention laws and how disease prevention can save tens of billions of dollars that can be reinvested in healthcare and cleaner production. Muhannad.
Thank you, Tim, and thank you, Bruce. Hi, everybody. All right, so I'm going to spend the next 10 minutes talking about the public health case for stronger pollution laws here in Canada, building on what Bruce said and Tim in his introduction. And not to go over some of the same points that were raised by Bruce and Tim, just as a quick kind of summary, we know from the COVID-19 pandemic that pollution is sort of now in the spotlight as an important factor, potentially an important factor in determining the severity and potentially the spread of COVID-19. Diseases such as heart disease, respiratory conditions, obesity, hypertension, diabetes are all risk factors for the more severe outcomes that require hospitalization and in many cases that lead to death. And we also know that pollution is a leading factor to these diseases. But those, as Tim alluded to, the pollution isn't just from the air, it's also from all sort of products that are surrounding us in our homes, in our workplaces, and in the grocery store. And in the next few slides, I'm going to go through some of the main sources of exposure to toxics that are helping to drive chronic illnesses in Canada and who is affected most. So who are the most vulnerable to these impacts or susceptible to these impacts. So Tim mentioned that air pollution kills nearly 15,000 Canadians every year. But the effects of air pollution are beyond that because many more people are getting sick from air pollution every year. The pollutants that are emitted from vehicles and industry, such as fine particulates and nitrogen dioxides, are driving asthma rates, lung diseases, heart conditions. And as I said, these are fueling the pandemic today. But just as COVID-19 doesn't discriminate, air pollution also doesn't discriminate, but it affects some people harder. In Canada, the issue of air pollution is largely an environmental justice issue where many communities like the Aamjiwnaang First Nation near Sarnia and other communities that live on the fence line of industrial pollution are facing greater health risks because of higher exposure to air pollution. A recent study showed that the rates of acute myeloid leukemia, which is a type of blood cancer, are 3 times greater in Sarnia, Hamilton, Thunder Bay, and other industrial areas in Ontario. But the toxics that lead to chronic health conditions, as I said, aren't just in the air that we breathe, they are all around us. So phthalates is a big example of a class of chemicals that you can find in all sorts of products, including food contact materials that are used in the processing of food, and also food packaging and plastics that package and contain the food that we buy. Phthalates are known to disrupt hormones and contribute to conditions such as obesity and type 2 diabetes, as well as lower fertility. And phthalates are just some of the thousands of hazardous chemicals that are typically used as additives in food packaging and plastics that we don't really know very much about. And even the government still struggles to get information about what kind of chemicals are in those products. Another example of a class of chemicals that we're concerned about because of the threats to our health is PFAS chemicals. So these are fluorinated compounds that are added to nonstick cookware. So Teflon is a big example of products that contain PFAS chemicals. And also they're added increasingly to stain and water resistant clothing and carpet. Although the companies have started to realize the threats posed by PFAS and started to phase out some of these chemicals, we're concerned about the use of these chemicals in paper board food packaging because many companies are moving away from plastics and looking to products that are safer and more sustainable. A recent report done by our partners, the Mind the Store campaign in the US, showed that PFAS are added increasingly to paper board takeout containers, as the report on the left shows. But also we know that these chemicals are being added to products that are used by the most vulnerable in our societies. In this case, infants and babies who, well, we know PFAS are added to the baby bibs, and baby bibs are often used and interacted with by babies in a way that might increase their exposure. And today we have 5,000 of these chemicals on the market, and these 5,000 chemicals are not regulated or tracked by the Canadian government. Another source of exposure to toxic chemicals is cleaning products and cosmetics. Chemicals like phthalates, which I mentioned earlier, which are used in a fragrance, and also parabens and silicones. The tricky things about these products is that fragrance ingredients are not required to be disclosed on labels under Canadian law. So consumers like you and me are in the dark about what kind of chemicals we're being exposed to when we're shopping for these products. And one study that we collaborated with American NGOs showed that more than 3/4 of the hazardous ingredients in a cleaning product or a personal care product often lurk in fragrance formulas. And unfortunately, because people are taking extra precaution to protect themselves from the novel coronavirus by cleaning and disinfecting more frequently, we've seen an increase, a significant jump actually, in poisonings reported to Health Canada from the misuse and overuse of disinfectants and bleach and other products that are used to clean our homes. February and March of this year saw a 58% increase from the same period last year in accidental poisonings that are reported to Health Canada. But as the risks of poisonings have gone up, also the chronic health risks have gone up from exposure to cleaning product chemicals. Many of the products that we use to disinfect our homes, including the popular Lysol wipes, contain chemicals called quats. Quats are lung and skin irritants and have been linked to reproductive health harms, and are also contributing to the rise of super bugs. So these are bacteria that are resistant to antibiotic medicine. And studies in Canada and the US showed that frequent use of cleaning products and disinfectants contributes to higher risk of developing asthma and chronic obstructive pulmonary disease in the home and in healthcare settings. What's unfortunate about the rise or the excessive use of disinfectants is that we don't really have a lot of evidence to show that there is a need for excessive disinfecting during the pandemic. There are no documented cases of transmission of the coronavirus by touching commonly touched surfaces in our homes, yet people are being advised to disinfect regularly, and the implication has been the overuse of harsh chemicals. As one infectious disease control expert in the US put it, what we're seeing right now in terms of excessive wiping and disinfecting is really more of a symbolic ritual, and we need to make sure that we're balancing those risks. And just how some workers in this pandemic face disproportionate risks, workers are also on the front line of toxic exposures. And despite that, our chemical law in Canada does not actually take into account exposures in workers, and doesn't offer workers the same protections that it offers everyone else. And these workers include cashiers, whom we know are exposed frequently to BPA from receipts, and also workers in the nail and beauty salon sectors, as well as factory workers and firefighters. And that basically has led to fewer bans of toxic chemicals in Canada compared to other places like Europe. So what is leading to all of this? Why is this all happening? Well, our toxics law hasn't really changed in 2 decades. So essentially we're using 20th century science to deal with 21st century problems. The good news is that the government has committed to updating this law, and the commitments that we have heard is that the work is underway, and we should be seeing a bill to amend this law this year. But we really hope that this pandemic does not distract the government from updating this critical public health law. Updating CEPA means a lot of different things. It would mean better bans and regulations on hormone disruptors and also on highly hazardous chemicals that could lead to cancer and other conditions. It would mean full disclosure of fragrance ingredients and equal protections for vulnerable populations. But alongside CEPA reform, we need to be tougher on air pollution. You would be surprised to know that Canada is the only industrialized country without enforceable air quality standards at the federal level. So that needs to be fixed. But to tackle air pollution, we also need to reduce the emissions from cars by promoting active mode of transportation, so cycling and walking in cities and neighborhoods, and also investing in public transit and incentivizing the adoption of zero emission vehicles like electric vehicles. Now, you've seen some of those headlines in the news and in previous presentations by Tim and by Bruce. But one thing that I wanted to highlight here is, seeing those stories of air pollution going down because of the social distancing measure shouldn't be seen as a silver lining. But what I hope that people would take from this is a realization of what our world could look like if we tackle air pollution, and that's possible with the right policies. If we prevent all deaths and illnesses from air pollution, we can save more than $114 billion every year. If we eliminate hormone-disrupting chemicals from products, we can save tens of billions of dollars. Imagine what we can do with those sums of money, whether it's investing them in bolstering our healthcare capacity and preparedness for future pandemics, if we're going to be facing a future pandemic, or transitioning us to a cleaner economy. And lastly, the other thing that is so exciting about pollution prevention rules is the potential for a green chemistry revolution. So if we update SEPA and update our laws to require that toxic chemicals are phased out and substituted with safer chemicals, that will drive innovation and investment in green chemistry, a sector that is promising to grow to $100 billion globally in 2020, so this year. Green chemistry is basically the design of chemical products and processes that reduce or eliminate the use or generation of hazardous substances. And we expect that a bill from the federal government to amend or update SEPA would include requirements for substitution and promotion of greener chemistry. And I will end here, and I look forward to the discussion, and I hope several questions that we will hear from our audience about the talk today.
Thanks so much. That was great. Thanks to you, Bruce. We're gonna have a lot of questions from the audience, but I have a couple that came to mind for me. Probably the one that encompasses what you both talked about is this difference between the fast-moving threats and the slow-moving ones. And Bruce, you spoke to this, but I wonder if in your research and research of others that you look at, have people uncovered why it is that we as humans react so poorly to slow-moving threats that that end up killing us versus so strongly to fast-moving ones? What is it about our makeup that means we don't react to these slow-moving threats from toxics as well as we do to something like this pandemic?
Well, I think there's a number of reasons, and I'm not a psychologist, but I think probably the most important one, to paraphrase Margaret Chan, who was a previous Director General of the World Health Organization, mosquitoes don't have lobbying to help them, whereas many of the products that we're talking about, the pollutants that are emitted, the chemicals that are found regularly in our food and homes, there are big lobbying efforts that keep those products out there much further along than they should be. So I think that's a big part of it. I think the other part is this, the uncertainty, and the uncertainty of this COVID pandemic is really, it really is scary. It's troubling, and I understand that that our reaction is so aggressive because of that. We're watching every death almost as it happens in our countries, so that's scary. At the same time, and what Daniel Kahneman talks about is it's important to make decisions quickly, intuitively sometimes, but it's also important to have leaders and experts who can help step back and say, what do we need to do today so that in 10 and 20 years, we're not dying from heart disease. We're not vulnerable to the next viral pandemic. And so I think it's really about how do we begin to get out of this short-term crisis-oriented way of operating our governments. It's understandable that an individual does that. It's not understandable that a government acts like that.
Thanks. And for you, Muhannad, I mean, in the US, we've seen the Trump administration rolling back air pollution regulations, the emission standards, et cetera. Have we seen similar things happening in Canada? And what has been the trend line around government regulation on toxic chemicals over the last 10 or 15 years? Are we going in the right direction or the wrong one?
Great question. I think there's a lot more attention being given in the news to what's happening in the US around efforts to roll back regulations, but we need to be looking at what's happening here in Canada, where we know in several provinces, including here in Ontario, there's been some actions by government to undermine some of the environmental protection rules recently, specifically around public engagement and offering people a way to, or providing people with the right to know about decisions that impact our environment. But we're also seeing industry lobbyists. So the Canadian Association of Petroleum Producers sent a memo to Cabinet asking for CEPA reform to be suspended, and also asking for many regulations that monitor and track air pollution from their industry to be suspended during the pandemic. And that's, you know, very dangerous, because as we saw in today's talk, you know, increasing air pollution even temporarily could lead to an increase in the rate of hospitalization, and that's not what we want to see in a pandemic. So efforts in Canada by industry to lobby and rollback regulations are underway, and we need to keep an eye on that. In terms of the question about the trend and where we're definitely going in the right direction, but we're really slow and we're not going fast enough. The fact that we now have 300,000 chemicals that are on the market worldwide, and thousands of those are coming into Canada into products that are imported into the country, we know nothing about them is of high concern. And the fact that we're so slow to update our law to enable us to better deal with these issues that did not exist 20 years ago, to me is something that is quite troubling, and might put us in a place in a few years where we might see the crisis of toxic pollution increasing exponentially.
Thanks. I notice we have a lot of questions coming in from audience participants, which is great. So I'm going to move to some of those because there's some really great questions here. One for Bruce. How can we measure, this is from Veronique, how can we measure link illnesses and deaths related to toxic pollution or exposure to long-term toxic chemicals? So how do we make that link when it takes so long for someone to get sick and die? How do we know that it's because of toxic chemicals?
So what typically happens is oftentimes we'll start with a cross-sectional study and show that people who in high pollution areas die more frequently than no pollution areas. And then those studies will spawn new ones where they follow individuals out. Perhaps in more dramatic ways, you can also find examples around the world where you close down an industry, like a silver refining plant, a silver refinery plant in Salt Lake City, and you see the number of pneumonias and hospitalizations decline dramatically after the industry is closed. So there's a number of studies, types of studies that we pull together to draw these conclusions.
Great, thanks. And from someone who's anonymous, but maybe I'll put this one to Muhannad. While we advocate for governments to phase out or ban toxics in everyday products, what can the average person do to protect themselves against them while we wait for government to finally act? So what can we do on our own, or is you know, are we kind of guinea pigs in the absence of government action?
That's a fantastic point. And I think the one point that I want to go back to that Bruce mentioned is that, you know, the onus shouldn't be on the individual. The onus is on the government to protect us and ban those toxic chemicals in the first place. But in the meantime, we should do our best to eliminate our exposure as much as possible, to reduce our exposure. So for example, when it comes to cleaning products, you know, choosing the safer alternative that includes or contains ingredients that are safer. So if you're looking for a disinfectant, avoiding, you know, disinfectants that have quats and going for disinfectants that have hydrogen peroxide or an alcohol-based active ingredient would really reduce our exposure to some harmful chemicals. And then when it comes to, you know, purchasing cookware, so nonstick cookware contain PFAS, as I mentioned, but there are so many other products that don't contain or don't have the additives that are added to nonstick cookware. So cast iron pots and pans, and also stainless steel pans and cookware would be the right way to go. So there are always options and safer alternatives, and as much as possible, we should go for those safer alternatives.
Thanks. Here's one from Aaron. Given how, oh, sorry, go ahead, Bruce, if you want to add something.
Add to that, there's a number of things that we've done in our household over and above what Muhannad has talked about. We've been able to move away from using any type of canned food. We use our Instant Pot for beans, whereas before we had to use canned beans. We've moved to glass jars with our tomato sauce. We grow more of our food, we can more, we buy our food at the farmer's market. My wife buys the food at a local grocery that doesn't use packaging. So there's a number of other things we can do. But once again, the only way to ultimately protect all of us is to have these regulations. These are interim steps that we can take.
Thanks. Great tips. You know, it's I think people forget sometimes that our steel cans just aren't steel cans, that they're lined with a plastic film that has chemicals in it that are dangerous, and so you're better to avoid those if you can. A question from Aaron. Given how globally integrated the chemical industry is, how do you think Canada should engage with international partners to understand all of these different chemicals and products coming into our country? And is this going to be impacted by the COVID pandemic? So are things going to change, and in terms of, I guess, global markets, but also do we need to try and address these things at an international scale rather than just, you know, in Canada? So maybe Bruce first, and then Muhannad, if you want to add something.
Yeah, absolutely. It's going to be critical to work internationally, especially recognizing that so many of our products come from the United States. In Europe, they are further ahead of us. They're more progressive around environmental chemical regulation. Their organic industry is much more advanced. And so one way to deal with that international market is to begin to work more with those countries that are progressive, that have taken steps to make sure that their products are safe. But it's clear that because we're a global market, that we have to constantly be aware of where our food is coming from and how it's produced.
Yeah, I think, Muhannad, maybe you just comment on that kind of raising the bar versus lowering the bar. I mean, there's always a tension in the global arena. Quite often we hear industries arguing, oh, well, the regulations are poor in country X. You know, you have to lower yours to that level or else we're going to move our factories there, that kind of thing. Mm-hmm. But I guess it could work in the reverse too. And Europe might be a good case, as Bruce has pointed out.
Yeah, I mean, we have seen it in few cases where Canada was the leader and was the first to act. So about a decade ago now, Canada banned BPA from baby bottles, and we were the first country to do so. And then after we did that, many countries followed. A few years ago, we also banned microbeads in personal care products, and we were one of the few countries that did that. And that was based on the kind of demand and the concerns from the public. So governments respond to those sort of demands. And we did not see any impacts on jobs in Canada. We did not see any impacts on the economy. If anything, that led to the development of greener and safer alternatives, as I was talking about green chemistry, where if Canada is now takes the leadership again in terms of having the strongest toxics law in the world, we're going to see manufacturing of green chemistry growing in Canada. We're going to see companies that value green chemistry and safer chemistry come to Canada and want to sell their products here. So that will have enormous positive implications on the economy. And Canada has a very critical role in the chemicals management space worldwide. We actually co-chair as a country one of the initiatives, the global initiatives on chemicals management. So we want to see that leadership on the global level being adopted here domestically, and then hopefully that will help actually make a big difference.
Thanks. Yeah, and the role of the public in pushing for these things is critical to note too, as those two, both BPA and baby bottles and microbeads, of course, were both campaigns that Environmental Defense was very instrumental in, and the public response to those is what moved government. So that's a critical piece of it, I think. We have a question here from Gail. I guess back to the COVID focus. All public spaces today are being disinfected, in quotes, repeatedly. Is there any information on the chemicals being used and their safety? I think you alluded to this, Mom.
Yeah, so unfortunately, a lot of the disinfectants and cleaners that are being used in the times of COVID have highly potent chemicals. And the guidance that's provided by Health Canada doesn't actually differentiate between, what's effective and best to be used in a home setting, what's best to be used in a healthcare setting. And that's really confusing people and to some extent misguiding people, because now, we're seeing people using, hardcore chemicals that they don't need to be used in their homes. But then again, we want to look at the evidence. I think one thing that I felt that this pandemic has reignited in our society is the importance of science and evidence. So we need Health Canada to look at the science of the impacts of cleaning products, and to provide advice to people about how to disinfect if they need to disinfect, and to constantly monitor the transmission through contact, commonly touched surfaces, which until today I haven't seen any documented cases of transmission from surfaces. So in the meantime, I think people just need to be cautious about what products they use. I have written a blog about safer alternatives to harsh disinfectants. So feel free to read that blog and get some of the tips that I have highlighted there. If you don't need to disinfect because it's not a high risk setting, perhaps you don't need to. Cleaning might suffice in that case.
Thanks so much. One of your slides showed vinegar. This is from someone, one of our audience members too. Is that okay to use in cleaning, and is it a good disinfectant against viruses like COVID-19?
Maybe I'll take a stab at answering that, and Bruce, feel free to jump in. So there's no evidence that vinegar is effective at killing the coronavirus. So it should not be used for that purpose. But vinegar is still an effective cleaner against some harmful bacteria. So people should continue to use vinegar if they want to, or if that's something that they've been doing over the past few years, to clean their homes, to clean their floors, and to remove dirt, which is key for disinfecting. Because if you don't first clean before you disinfect, the disinfection is not going to be effective. But just keep in mind that vinegar doesn't actually work in killing the virus, and it's better to use soap and water, or use an alcohol-based disinfectant.
Thanks. Another question from Martin. How can we convince the government to use the precautionary principle for all chemicals entering the country? So precautionary principle being like we should be assume that they're not good unless we can prove otherwise. Bruce, what's the best way of tackling that?
Well, having good science, of course, is essential, but we do have enough science. We know we've made so many mistakes over the past century, for example. One example are what we call regrettable substitution. So initially we used lead arsenate in our orchards and in our cotton fields. And then we realized, whoops, those are toxic, and we moved to DDT. Whoops, that's toxic, we moved to organophosphate pesticides. Now those are in the process of being phased out or banned. And we're using pyrethroids and neonics and glyphosate, and now there's new evidence that those are toxic. All the while now we're beginning to realize, well, maybe we don't need pesticides to feed the world. And maybe we don't need pesticides in and around our homes to make the gardens pretty. We have alternatives. And so I think the evidence is there. What's missing? It's the public. We need the public to pull together the data and say enough. It's not enough to have environmental defense speak out. It's not enough to have scientists speak out. Until the public says enough, we aren't going to get there. Our leaders need our help.
Great, thanks. One final audience question, and then I'm going to ask you guys just a wrap-up question because we're getting near out of time now. But from Richard, do you think that making a greater connection between the actions to fight climate change, for example, auto emissions reductions, electric vehicles, and the corresponding reduction in air pollution will be a win-win for both crises? So especially now that we've seen, as I mentioned at the beginning, we have less pollution in the air because we're less active, we're driving less cars. Do you think that fighting these things together, drawing the links between, could be a win for both? So Bruce, you, and then Muhannad.
I think that's a great question. And one of the things that I've been struggling with is that while we have put a lot of our effort towards climate change, which is important, absolutely important, we have also neglected many of the other planetary boundaries, those other things that could basically wipe out human existence. Having adequate water for life. Toxic chemicals. When you look at toxic chemicals as one of these huge planetary boundaries, those things that could just wipe out Earth, that's always a big question mark. I mean, we know a lot, but there's so much we don't know. And so I think absolutely we need to begin to look more broadly, looking at air pollutants, absolutely, looking at climate change and recognizing that they're all part of the same picture. And it's not just climate change, it's not just air pollution, it's not just fresh water, it's all of these different planetary boundaries that are so critical for us to look at. And until we have a concerted effort, maybe we won't make the headway we need to. Maybe we'll remain fragmented, and that fragmentation will allow us to do nothing.
Yeah, that fragmentation is challenging. I know, Muhannad, you run into this in your effort to work on SEPA reform, the legislation around toxic chemicals. But of course, it's not just about the toxic chemicals. It's also what's going on with climate change. It's going on with other things as well. How do you bring forward a narrative about the need for overall reform to a more sustainable, toxic-free, circular economy when you're doing this in Ottawa?
Yeah, I mean that's a very difficult task, and I've struggled with how to communicate that with policymakers. But I think the opportunity is just getting more ripe now to do so. So if we think about the momentum on plastics and how the government is committed to deal with the plastic pollution in a comprehensive way, that would have huge benefits for our public health, because a lot of the toxic chemicals that are in plastics, and also plastic production, from the outset has air pollution issues, because petrochemical production is going to be a driver of air pollution, and also a driver of GHG emissions in the next couple of decades. And there are communities, as I mentioned, who are most vulnerable to those impacts because they live near those industrial sites. But I think the winning argument here for me is that toxic pollution is this tangible thing that we know impacts our health. We have all the science and the evidence to show that exposure to an endocrine disruptor in a pre-birth can have huge impacts later in life. And we need to focus on that evidence. We need to listen to epidemiologists and public health experts who are now, the rock stars of the country in the COVID-19 pandemic, but often, in issues around toxics are not really listened to, because toxicology that is promoted by the industry overpowers the epidemiology science. And the other thing that I would want to highlight is, in today's presentation, we talked a lot mostly about public health, but toxic pollution also impacts wildlife and endangered species that are on the brink of extinction. So the orca population, the southern resident orca population out west, are hugely affected by, or is hugely affected by flame retardants that are toxic. And by eliminating flame retardants, we can improve our health, but also help this species to survive. So we need to think about those connections and put a dollar value next to each benefit that we're going to gain.
Great, thanks. Well, thanks to you both for taking the time to participate with me today and just chat about these issues and the relationship between something that we're paying attention to every day, like the COVID-19 pandemic, and these longer term but very, very important issues around toxic chemicals. Unfortunately, that's the end of our time for today. So we'd like to thank everyone from the audience for joining us today and for the really thoughtful questions that we have. Next week, we're going to answer some of the questions that came up, some of the ones we couldn't answer. Those are going to be in the form of a blog, and so you'll be able to check that out on our website next week. I really want to thank as well environmental defense supporters. All of you, as I mentioned, have been key to making progress on this file and many others that we work on. But in particular, having the public stand behind us as we talk about things like the risks of BPA or phthalates or these other things is actually what makes government move on it. And once you've worked inside, like we have, working with government officials, or you've spent a lot of time talking to them, they'll tell you the same thing. If it's not for people like you putting pressure on them, things would not move. And that's absolutely true. We really would like you to stay involved and continue to help us move these issues forward. So if you you can sign our petition to tell the federal government to implement stronger pollution prevention laws and strengthen Canada's Environmental Protection Act. And you can go and sign our letter to send to MPs at environmentaldefense.ca/toxics. And we're going to send an email next week with a link to this petition in case you just didn't get that down right now. And then as part of our series, we're going to be back again next week at the same time with a special two-parter on the green recovery. On the first week, we're going to be debunking claims against green recovery efforts by examining a controversial new film that many of you have asked us to comment on. You may have seen this online. It's called Planet of the Humans. The executive director is Michael Moore. And we're going to be looking at what the film gets wrong and explore scientifically supported facts about renewable energy and other climate change solutions. So stay tuned for that next week. It's a really interesting conversation. And please stay in touch with Environmental Defense, both over email, over the phone, but you can also follow us on Twitter, Facebook, Instagram. And again, thanks very much for joining us, and we'll see you next week. Bye-bye.